Welcome. I'm Bill Kadereit, president of the NRLN and your podcast host. The subject of this podcast episode is preparation for the October 2022 start of the Medicare annual enrollment period. My goal is to emphasize the importance of being prepared for enrollment and to provide some tips on how to do that and help you get to the best place possible so that you can get the best deal possible. Don't feel rushed. You don't have to make final decisions early. Enrollment doesn't end until December 7th. We're interested in your feedback, comments, or requests for sources of information, but it's impossible for us to make your decisions. But if you have questions or answers or comments, please go to NRLN.org and then the contact NRLN.org email address and give us your feedback. And if you would, sign up to get our emails. Preparation is important. So if you're enrolling Medicare for the first time, or at any time during 2022 and future years, get prepared first before you call an insurance agent or other advertised 800 type numbers. It's very important to read and understand your copy of the Medicare and You 2023 handbook. Learning it could save you time and money and will build your confidence and competence in enrollment period. If you didn't get one, you can go to Medicare.gov or simply click the icon at the lower end of the center column on our website homepage, NRLN.org. You can read the book online or download it and save it and read it later, but getting your own copy by mail each year is the best. It's authoritative, updated annually, and if you go to page 128, you can see contacts for getting more information. And on page 9, you can get a Medicare card replacement. Medicare and You recommends that you start signing up process by comparing your plan and plans for others. I personally believe that that's kind of putting the cart before the horse, and it places you in front of insurance agents and 800 in-call pressure you shouldn't have to have and should avoid at this stage. Instead, first examine your economic situation, your affordability status. Then take a look at your health status and the prospect for continued good health, currently and maybe 10 years out from now, including a review of your health history of your ancestors, just like the insurance companies do when they're trying to qualify you for getting more insurance. You don't have to be perfect. Just consider what you know and also consider the changes that might occur and the injury risks you may incur as you go along and age through your senior years. This exercise is exactly the kind of thing you do when you annually go to your doctor's office and they give you a questionnaire and ask you to fill it out. You have to put all the information in there about your drugs and your health history and the history of your health of your ancestors. What your doctor's trying to do is get a profile of your health status. And then you meet with a doctor, of course. These important risk factors should precede hearing insurance sales pitches or calling 800 numbers to make plan comparisons. First of all, we must know what we need and want before we can buy it. So talking to a salesman is a little premature. Equally important is knowing your 2023 and beyond personal budget expectations about your family income and costs. Your Social Security income, investment income, IRAs, 401ks, they're all critical pieces of this study. The table below is information that was recently announced about Medicare premiums and deductibles and about Social Security that may be helpful for you as you begin the journey. As you can see, Medicare B premiums will be $5.20 a month cheaper at $664.90. And the deductible for Medicare this year is dropping by $7. Combined for the 12 months, it'll save you about $71 a year or about 3%. The big change is in Social Security, where an 8.7% increase has been announced. And that you can roughly guess that is about $87 per $1,000 in Social Security benefits you currently receive will be the increase. Then we have to look at your personal home and other expenditures, but they're predictable. You know them better than anyone else. But we have to include your guess, of course, of inflation and just basically your home budget. And all that put together kind of tells you how much you might be able to afford to meet your healthcare needs in terms of buying buying a plan and selecting it during this enrollment period. You have to determine how much you can spend on healthcare monthly and annually to protect yourself. So now we have an inventory of our current health status and affordability. Let's take a look at what's available to us. And those of us who are in Medicare know about our risks. But when you're new to Medicare, you have to be thinking about chronic illnesses, accident-prone trips, forgetfulness, that creeps in, slower reflexes. All these things put us at risk at the same time we need a price or a good deal. So let's start then and look at what is the Medicare and You handbook diagram that shows that on the left, you have a choice of original Medicare, Part A and B, and on the right, Medicare Advantage Plan C. Both of these two choices require that you be provided all the benefits in Medicare A and B. And the premium is the same whether you're in original Medicare or you're in a Medicare Advantage plan. Then you can have your choice of a prescription drug plan. You might get one. 70% of the Medicare Advantage plans include one. You have to buy one if you're in original Medicare. And eventually then if you want a Medigap plan, you buy that also. So this diagram is showing you the two fundamental choices. We're going to break that down in terms of the cost of each and how you might get at making a decision on them. The Medicare pays 80% of the Part B benefit costs, but you have to pay 20%. And this is the big issue as you move forward. And this could be a sizable amount if you encounter a significant injury or a long-term chronic illness. This 20% risk and your affordability to pay for it is at the heart of our insurance decision. Chronic illnesses like diabetes, varieties of cancer, and other illnesses, and your ability to choose doctors and specialty centers like Mayo Clinic, Johns Hopkins, MD Anderson, etc., are key factors you have to consider. This is a comparison list of original Medicare versus Medicare Advantage benefits it's on page 11 of Medicare and You. If you go to that page 11 list, you'll see the comparison and the contrast of those benefits. If you select a Medicare Advantage plan after your 12th month in Medicare Advantage, you can switch to original Medicare, but to buy a Medigap plan, you must meet insurance underwriting requirements. Pre-existing conditions could lead to denial or conditional restrictions and much higher premiums. Medicare Advantage enrollees cannot pick their doctors or clinics of excellence. Out-of-network doctors or specialist excess charges may be applied, and they'll not be covered, or prices could be exceedingly high, and claims are sometimes denied, and upcoding, falsification of risk, and other issues have been identified with Medicare Advantage plans. So just beware of those little tripping points. The risk in choosing a Medicare Advantage plan depends upon your current state of health and prospects for good health as you age. And on that diagram, step 2, it was references to prescription drugs. I want to make this comment that will help you in choosing a plan. If you go to mymedicare.gov, sign up for your mymedicare.gov account, where you can upload your prescription drugs by type, by name, and all the other information that is needed. And if you choose original Medicare, with or without Medigap, you must buy a separate plan. And if you have a Medicare Advantage plan, you may or may not have a plan paid for. So you have to go to page 122 of Medicare and You, where all drug plans and prices for your state are already listed there. And what Medicare does in that process is match up your inventory of prescription drug needs by drug type. They check the formularies of all the plans out there, and they come back with a list of the plans that provide the drugs that you need, and the plan prices, the premiums, and deductibles, and so forth. So it's a valuable tool, Medicare.gov, and then establish a Medicare.gov, a personal account for yourself. Now we know all of what we talked about to this point. It's time to use your health and budget data to review the Medigap alternatives. Slide 5 here, table is a table on page 76 of your Medicare and You handbook. It shows benefits available in each of 10 Medigap plans for sale in the United States. Excepting the asterisk note at the bottom of it, Medigap plans are basically commodities with common benefits in all 50 states. Now, let's use your personal health and affordability information to select a Medigap plan that suits you. And let's compare plans with the best coverage, Medigap, let's say C, D, and G. Plans C and F, shown on this chart, are not available for those new to Medicare after January of 2000. But you can switch if you're eligible. That is, if you were in Medicare before 2000. So that's a factor. Among these plans, the best protection is Plan G. If you're in Plan G, all you have to do is pay an annual deductible of $226 in 2023. And that's it. That covers everything that Medicare does not cover. That is, it covers all 20% of the charges that Medicare does not pay for. They, of course, cover the 80%. If you choose to, you could buy a Plan D, but if you buy a Plan D, you not only pay the deductible, but you'll notice that the excess charges are not covered. Now, this could be significant if you have to go to the Mayo Clinic or have some special out-of-network charges. If you have a Plan G, they're all covered. But if you have a Plan C or D, they are not. Now, Plans C and F, since they're not available, basically for your new entry into Medicare, then it's the best solution is D or G, and G is the premier solution. So let's take a look now and see if we can't evaluate the differences between a Medicare Advantage HMO plan and a Medigap G plan. And so we'll move now to this busy looking table, but let me clarify what it's all about. We're going to look at these comparison between, in the green column, an OEM with a Medigap G, and in the gray column next to it, a Medicare Advantage HMO plan with an out-of-pocket maximum. And those two are side by side. Directly above it, you'll see ages 65 to 70. So on this side of this table, we're going to look at the cost to you between ages 65 and 70 based upon an assumption of prices and the cost of healthcare and the frequency of usage for people who are generally healthier than older retirees. And then we're going to compare that with, to the right, the gray column to the far right, only it's in an age group, covers an age group 70 to 85. So the overall thought here is to determine how much more you're going to pay when you're a little older than you are, and maybe prone to subject to chronic illnesses and very debilitating kinds of issues, versus being age 65 to 70, when you still might be running 3 miles a day, and swimming and golfing and doing everything else you can do. So clearing the chart further, on the far left, you see these rows. The top 5 rows are the premiums associated with these plans. There's no premium for Medicare A. For Medicare B, the premium is $165 a month. In the columns, it says free fee event. And then you're going to pay that for every month. So there's a 12 in the next column. And 12 times 165 is $1,979. And whether you're in a Medigap G plan or an HMO plan, no matter what your age is, you're going to pay that premium, $1,979. Everybody pays a Medicare B premium, unless there's some cost sharing in HMO, and we'll talk about that in a bit. There can be extra premiums for Medicare B in an HMO plan if there are added benefits that are not subsidized or unwritten by the insurance companies. The line 4 shows the Medigap G plan annual premium of $180 a month, or $2,160 a year. That is the price you pay for a Medigap G plan. And if you add all the premiums up in lines 1 through 5, you'll see that Medigap G plan is going to cost you $4,139 a year in premiums versus $1,979 for an HMO plan at age 65, 70. The big difference is rows 6 through 9. The deductible per benefit period is about $1,650. I think the real number is $1,600 is just announced. For each benefit period. Now, many people don't know this, but the Medigap G plan pays that $1,600. But if you're in an HMO plan and you go to the hospital, unless they waiver this expense, you are liable for $1,600 every benefit period. And that means if you go in the hospital and you're in the hospital for more than 3 days and it costs you $1,650 for the room and all the associated costs, it comes out of your pocket, or in Medicare HMO plans, it is charged to your out-of-pocket max and you pay the bill. The next line is a Medicare B deductible, and everybody pays that, $226 a year. So that green column, however, you'll notice for Medigap G shows absolutely no co-pays and co-shares. And that's because no matter how old you are or how sick you are, that's all you pay. You pay the premium of $41.39 and you pay $226 for the deductible for a total of $43.65. Now, what we've done here is we've estimated that if you have an HMO plan, you're going to incur some of those rows 8A through 8F visits, doctor visits, specialist visits, durable medical equipment is another one down there on line 8F. And so that incurrence and this estimate totals $3,675. Now, this is where you come in. You get to put in the number of events that appear to be what you know you're going to require. Instead of 2 visits to the doctor, maybe you think you're only going to go once a year, and that's fine. This is a tool for you to use to make an approximation. So you'll notice in following just on the left, to these columns, the green and the gray, that on the HMO side, the total is $3,675. Well, that's well within the $5,500 deductible on line 13. So that comes out of your pocket if you have an HMO plan. So sometimes people get confused about out-of-pocket max. And what that really means is you're liable for the first $5,500. So in that gray column, you're liable for the $3,675. And that's it. What that means at the bottom line in those little pink boxes is that Medicare bottom line, Medigap problem, total cost is $43.65 versus $36.75 in HMO. And you can say, wow, I'm buying the HMO plan. I'm going to save what is effectively $58, call it $60 a month, or about $700 a year. However, if you haven't anticipated what's going to happen to you when you're 70 or 75, look in the right 2 columns. Let's say you have a 3-day period 4-day, 5-day period in the hospital, and that $1,650 in deductible has to be paid. So that's what the number one is. That goes in the cost column out of your pocket. And so down the line, for example, on line 8C, you'll see $5,000 12 times. Well, somebody has cancer. You can easily spend $60,000 a year, $5,000 a month for 12 months. You can easily have ancillary drugs associated with it that are not prescription, but they're other drugs that private physicians can order for you. Let's say that's $200 a month, so and so forth. And it all piles up on you. On top, only thing different is there are 4 on line 3. There are 4 premiums for some small incidental added benefits. So the bottom line is on the right side, if you do incur these chronic illnesses, you've got $67,000 in bills. However, you're protected because you still have an out-of-pocket max of $5,500. That's all you can have, all you can pay. So what's the deal here? Well, the real deal is when you have to pay $5,500 every year, as you will if you have these chronic illnesses that last for the rest of your life, then you have to compare that with Medicare G's $4,365. And if you do that, you're out $95 a month or more if they raise your out-of-pocket max figures. So that's the secret. The secret is if you don't acknowledge your possibility for being a lot sicker between the ages of 70 and 85 than you are today when you register, you may find yourself paying that out-of-pocket max every year, and invariably, in the cases I've looked at least, that's always been higher than the cost of a Medicare G plan. So beware, take that into consideration. I know it sounds like I'm beating up Medicare HMO plans, but I'm not. We know of a lot of people who fall into that trap, and it's not an easy one to get out of because it's very expensive. So that's kind of the full review on this table. And if you have questions, why, those are good questions to ask. Now, if you want to follow up and determine or look at all those numbers on the left from A to A through F, those red numbers, they come on, you can find them on page 119 through 127 of your Medicare and You handbook. So that information is available for you to look at. So what you want to do is make the best estimates possible that you can of your affordability and your healthcare status and projected status. Then choose Medicare Advantage and the specific plan, if you will, or Medigap and the specific plan that you will. You have all the information together, then call a SHIP counselor to test your plan and your selection. Then call an insurance company directly first, then an agent or 800 number, maybe if you have to get that far, and you'll get to the right solution for yourself. Now I want to show you just some information because I know some people are going to say, well, I'm not paying anything for the co-pays and so forth. And you may not. But here's the down and dirty secret about HMO versus Medigap or HMO plans in general. And you may be hearing a lot about lately. A lot of organizations are attacking them for their inefficiency and higher cost than traditional Medicare. It's coming to light more and more. The first row on this chart shows that the same information we looked at above, 4365 versus 3805 versus 5500 on the other side for the total Medicare A, B, and D healthcare previous costs there. But Medicare Advantage plans are subsidized. And they're subsidized to the tune of $165 a month or $1,980 a year for every single person in Medicare Advantage. That's about $57 billion a year for 27 million people. 51% of that, $165 a month times 12 is $1,010. which means that for everyone in Medicare, no matter what your age is, Medicare Advantage plans, the insurance companies can offset your cost sharing. That's line 14 is cost sharing by $1,010 because the government is giving them the money to do it, to make these plans look less expensive when they really are not. That $1,010 includes profit and overhead for the insurance company. And they may not spend all of it. No one knows because there's no direct reporting back to the government. But that would net on line 15 then, would net the total cost down to $2,795. And the difference then jumps all the way to $131 a month. But even at $131 a month, you could still make the decision. I'll pay that and keep my Medigap G or not. It's a very important factor to consider. Line 17 is not really a cost line at all. Line 17 is the complement of the 51% of this $165. It's 49% of the $165 or $970. It's the rest of the $1,980 I mentioned earlier. It's 1,010 plus 970. That 970 buys the extra benefits, the vision care, the golden silver sneakers, and those other benefits that are prescription over-the-counter drugs, clean your air filters, and steam your carpets if you're in Medicare Advantage plan. All those extra benefits are worth $970 a month. And that money, that $1,980 total, comes out of the taxpayer general revenue, which means that everybody in Medicare, including those who have a Medigap plan, and every other taxpayer in this country who pays income taxes, is paying a chunk of this free money that is being subsidized by the government, subsidizing the insurance companies. So it's complicated, but yet it's pretty simple. Make your decision based on that first chart, and you take out of consideration all these extra benefits and subsidies, because now that Medicare Advantage plans have a 49% market share, there's going to be a lot of pressure to get rid of this subsidy money. The data shows that a point when annual Medicare HMO plan premiums, deductibles, copays, and coinsurance combined reach or exceed the plan out-of-pocket maximum $5,500 in this example, you might be better off buying a Medigap G plan and paying only $4,365. Very carefully examine this from a year-to-year basis. Now I'm going to take a quick look at, is $180 premium good premium? In the state of Florida, which you'll see in a minute, they have a program that provides and discloses to all citizens down there the premiums for all Medigap plans by county. And this table you're looking at now is Sumter County, Villages, Virginia. The people in the villages, most of the people in the villages, Sumter County and Sumter County. And so we looked at, and this is just October 10 data, so it's really fresh, Medigap C, D, and G. The one we're talking about is Medigap G. There are 38 plans, and the high of the premiums charged available down there in a plan is $3,437 a year. However, there's a low plan premium also, $2,127 a year. So since all the benefits are exactly the same, no matter what these plans are, no matter where you're at, you're going to get the same benefits. You can save $1,310 if you can find that low premium. And today, for the most part, you can't. And what we discovered is that insurance companies, sales agents, and national sales agents of healthcare plans are not obligated to provide all those prices to you. They only tell you the prices that they are carrying in their portfolio, their quiver of plans, for example. If I were an insurance agent and I chose to cover 4 Medigap G plans, and the cheapest one was $2,500, and the most expensive one was $3,437, I might tell you that of the 3 cheapest ones, but the best deal you're going to get is $2,478, when in the same time, I might know there's another plan out there that could be bought for $2,127. Why? Why would that happen? Well, the higher the premium, the bigger the commission. And so the facts are the business world is kind of mystical. But when you get a place like Florida that actually shows you exactly what the premiums are for every plan, you get to make a real choice and you get a better deal. Now, that's a 38% savings off the top end, but if you invert that, you're paying 62% more if you get the higher price than if you get the low price. So wherever you go, when you talk to that ship counselor, no matter where you live, tell them to find you the cheapest price for the plan that you want to buy, because chances are they're all qualified, they're all financially qualified, certified, been accepted by the state, and would be for the most part satisfactory. In this case, and this is really odd in a way, among the 38 plan Gs listed there, 7 of them are priced at under $2,280, which was our $2,260. I'm sorry, which was our $180 a year, dollar a month number we used. And 3 of those 7 are Hartford, Blue Cross Blue Shield, and United Healthcare, which means they're selling at the low end there. And so basically, what I'm trying to reinforce is that you can get a good insurance company's plan a lot cheaper if you can work with the ship agency and find out what's the lowest price by plan in your state. So before you enroll, you may have more questions. So if you do, make sure you contact your ship agent, your local ship person in the state you live in. Their counselors are usually well trained and can work on your personal plan with you. If you have or will get a copy of your Medicare and your handbook, your ship number is on the back cover just below your personal name and address. SHIP can help you find the pricing information by plan if you can get them soon enough in the process. So I hope this episode convinced you that it will be worth your time to prepare, and that in the process you can become more confident enough to make good choices. So that's it for today. Unless you plan to switch or need time to apply for a Medigap plan acceptance, do not jump the gun. Enrollment does not end until December 7th. Do not forget to sign up for our messages at www.nrln.org and watch for our next podcast date. Thank you very much. And as always, remember, seniors are special.